Good morning, Dennis. My name's Savannah. I'm going to be the nurse caring for you today. I'm going to be doing some IV push medication. I'll be in here for about 10-15 minutes to do that. Is that okay with you?
Yes.
Before we begin, I'm going to go ahead and do a quick safety check, just making sure your bed is locked and it's lowered. There's no clutter on the floor. You have your bedside table near you. 3 of the 4 bed rails are up, and you have your call light. So like I said, I'm going to be doing an IV push medication. It's your furosemide, which is your Lasix. It's going to be taking fluids off your body. You may feel the urge to pee with this. But before we do that, I'm going to just ask you a couple of questions. Can you confirm your first and last name for me?
Dennis Zoltanicki.
All right, and see here. And how old are you?
59.
59. Do you have any allergies?
Not that I know of.
Alright, and I see here that your MRN number is 7745737, and on the chart it's 7745737, so everything matches. I've already done my first and second med check, so I'm just going to go ahead and do my third by going to the provider's orders and making sure it is ordered. And I see here furosemide 60 milligrams IV push ordered for now. I'm going to go ahead and confirm that with the MAR. And again, furosemide ordered for now, 60 milligrams IV push. I'm going to go ahead and scan that in as part of the third med check. Making sure I'm scanning the right medication. All right. I'm going to go ahead and put the time. Okay, IV push, and I'm going to put my initials. All right, so now that I've got that charted in and I've done my first, second, and third med check, I'm going to go ahead and drop the medication for you. So I'm going to come here, just make sure I have everything. I have my medication, my 2 flushes, the correct vial, my medication cap, and my wipes. Just gonna go ahead and put on some gloves. And I'm going to clean the vial with an alcohol wipe for 15 seconds. All right. And I would drop 6 milliliters of air because we're drawing up 6 milliliters of furosemide, but because we've used these vials so much, I'm unable to. So I'm going to pretend that I do that. And then I am going to go ahead and drop this medication. All right. Make sure I have 6 milliliters, and I do. I'm going to go ahead and safely recap my vial. I'm going to go ahead and check Nursing Central just to confirm the time. So I'm at furosemide. I'm going to go to IV administration here, and I see IV push 10 milligrams per milliliter, and then I would push it 20 milligrams per minute. So because we have 60 milligrams ordered, I drew up 6 milliliters, so I'd push it over 3 minutes. Before I push it, I'm going to go ahead and label my tubing so I don't get them confused. So I'm gonna put the date and the time and what it is so I don't get it confused. So I have my furosemide labeled. I also have my flush labeled since they are in similar syringes. All right, so now that I've done all that, I'm gonna go ahead and wash my hands, put on some gloves, and assess my patient's IV. All right, Dennis, I'm about to assess your IV. Can you tell me if you have any pain or tenderness at the side of the IV?
No, I do not.
Okay, good. All right. Does that hurt at all?
No.
No. So I see that the IV is not swollen, there's no redness, and the patient says that he doesn't feel any pain or tenderness, so that's a good sign. I'm gonna go ahead and get a flush and wipe the IV site for 15 seconds since there's not a cap on there before I check for patency. So all right, and without contaminating the tip of that, I'm gonna go ahead and get my flush. Go ahead and prime that. Open up the cap, draw back and see if I get blood return, and I do, and then flush it, and it flushes. So I'm gonna go ahead and cap that and leave the flush on so I don't have to worry about re-wiping it and everything stays sterile. So now, since I've confirmed the time, I've labeled my tubing and my flush, I'm gonna go ahead and push the medication over 3 minutes. I'm going to take the needle off safely and cap that. And again, this is over 3 minutes. Dennis, do you live around here?
Yeah, I do.
Okay, I do too. It's a nice area.
Yeah, I moved about 20 years ago.
Oh wow. Do you have any kids?
Yeah, I have 6.
Oh wow. You have 6 kids. What are their names?
Sometimes I forget.
I do that too. I have a dog. His name is Dash. I've had him for 5 years.
Like that movie in The Incredibles?
I haven't ever seen The Incredibles.
Everybody's seen The Incredibles.
I'm not like everyone. I'm unique. Alright. 1 minute in. 2 minutes in now.
Thank God.
How are you feeling?
Pretty good. Just tired.
Yeah.
We ready to get out of the hospital.
Well, hopefully you can get out of here soon. We started at 09:37 and we're at 09:38, so we have 1 more minute to go. We're almost there.
So you said this might make me pee?
Yeah, it's just going to be taking fluids off of you. I'll give you a urinal so you don't have to worry about getting up very much. Might help you out a little bit.
Alrighty.
Alright. We're almost done though. Just a couple more seconds here. I do have to do the same thing with the flush, so it's going to be another 3 minutes with that.
Okay.
I do apologize. Alright. So that's all in. And keep that there. Get my flush here. Alright. And again, without touching the end of the vial, I'm going to go ahead and connect my flush, and it's 09:39 right now, so I would push for 3 minutes with the same amount of fluid, so 6 mLs. And I'm going to start at now. Okay, so it's 09:40 right now, so we'll finish at 09:43. You still feeling okay?
Yeah, I feel fine.
Okay, good.
I was like pushing it and I was like accidentally like it went like that and I was like and I didn't do it.
Where did you move from? You said that you moved here 15 years ago?
Yeah, from Tennessee.
From Tennessee, okay. I've only been there twice in my life. I like the aquarium there.
Yeah, it's fun.
Yeah. Why did you move?
It's closer to work.
Okay. Where do you work at?
At a shop in Atlanta.
Oh, cool. What shop?
An auto shop.
So you're a mechanic.
Yes.
Okay. That's cool. Y'all gotta make a living somehow. 1 minute in. So we're doing 2 mLs per minute, so we have 4 mLs to go. We're almost there though. Do your kids go to school around here?
No, they're all grown.
Oh, okay. Yeah. I don't have any kids. I'm only 22.
Well, I had my first kid at 21.
Oh, wow. 1 minute to go. We're almost there. All right, we are there. So I'm gonna go ahead and clamp this off so backflow fluid doesn't come. Unclamp this and clean up my mess here that I've made. And then I would dispose of everything, including the needle and the medicine vial, into the sharps container. But because we're reusing equipment, I'm unable to. So I'm gonna place everything here and dispose of my gloves and wash my hands. All right, Dennis, are you still feeling okay?
Yeah, I feel fine.
All right, well, like I said, this medication may make you use the restroom. I'm gonna bring you a urinal in here so it makes it a little bit easier on you. Your call light's right there, so if you need anything at all, please just do not hesitate to call me and I'll be in here. But I'm gonna go ahead and do another safety check and make sure everything is locked and lowered. Your floor is clutter-free. Your bedside table is near you. You have your call light, and the 3 out of the 4 bedrolls are up. Thank you for letting me take care of you today. And again, I will be in here in about 30 minutes to reassess you, okay?
Okay.
All right. Thank you, Dennis.